respiration rate would be? Well, for an adult, again, it's going to vary depending on what they're doing, how excited they are, but anywhere from 12 to 36 per minute. And for a calf, again, it's going to be a little bit higher, 30 to 60 per minute. And when do you want to check their respiration? After you chase them into the working chute? Obviously not. I mean, Justin's got some heifers out there. He chased them in, and they've been sitting there for a few minutes. We could go out there right now and have a look and get a pretty accurate representation of what the respiration is. And once you bring them in here and get them all riled up, it's not really that much use. And in terms of pulse can be a bit tricky to find. Sometimes they can find the pulse on their jaw. Sometimes you can find it. There's an artery underneath their tail head. You can pick up a pulse under the tail head. Or you can use a thermometer or a stethoscope. And again, a cheap stethoscope will give you a lot of information. And so it's not a bad investment to have a stethoscope in your vet supply kit. And again, normals are going to vary depending on the activity level of the cow, but anywhere from 40 to 80 for an adult animal, and a little bit higher again for a calf, 100 to 140, depending on their activity level and that sort of thing. So I guess maybe pass it off to Dr. Sutton.
No, I'm just a overseer. If you make any mistakes, let me know.
Question?
Yes.
With the use of a stethoscope, what about gut sounds too? Is that?
Gut sounds can be useful to pick up. Yes, good point. And for a cow, you want to listen on the left-hand side for the rumen sounds. And you should hear 1 to 2 contractions per minute. And that sounds, how do you describe it?
Like a real slow washing machine.
Slow washing machine.
I mean, like a really slowed down, and you just put that stethoscope right in that paralumbar fossa, right in that V on their left side behind the ribs, and just be patient, and you'll hear something once or twice every minute. You can hear it, and it'll go through its whole cycle as it comes back.
And there's conditions that will make them hypermotile, so more than that, and hypomotile is more common when they're off feed and not eating, their stomachs just not moving. So you can pick up hypomotility as well. On the other side, you can hear some churning and gurgling. It's not necessarily too specific. Dairy cattle, a little bit different. They have various diseases of the abomasum, the forced stomach, where their abomasum shifts positions, and they can ping, they call it ping animal. You can hear a real high-pitched ding, 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 and that's a sign of an abomasal problem. So for various classes of cattle, we use different techniques. There's not so much a problem in beef cattle, these displaced abomasums, but it is something that we'll probably check if we're looking at a sick cow for you. So maybe we'll run a heifer in, and probably questions will come up as we're having a look.
On hand, almost no matter what you're doing. It's just, it's amazing how much disease contamination you avoid by having those things on hand. Some other things that we've got here, we got some Novosan disinfectant. This is the concentrate stuff. You can get this from your veterinarian and other places. You dilute that, have a little bit of it on hand, so you can disinfect everything from needles and balling guns and halters. I mean, this is a brand new halter. It's never been used, but looks like I stored it where there was a little mold action. And so, these things are not sterile, even if they've been sitting around and never been used before. Alcohol works great. It's not real good for tissues. If you're going to be working around eyes or mouths or stuff like that, alcohol is a disinfectant, but it's pretty tough on tissues, whereas Novosan is a lot kinder and doesn't cause a lot of irritation and stuff like that. This is another thing we've got here, which obviously the field station's got. They fill these things up. Sharps containers. It's a good idea to have Sharps container around for all kinds of issues from safety and liability and other standpoint. Want to go over the picture of the injection deal? That might be good.
Sure. So, of course, beef quality is a primary concern. It's easy to be lazy and use all that nice muscle in the back area for your injections and so on, but this is a good picture showing the areas where we want to give injections. So it's a triangular area in the neck region there, just above the spine actually runs quite low in their neck. So you want to be above the spine to give your injections there. General rule of thumb, if you're given more than one injection, keep it about a hand's width apart. If you're given, say, 2 injections on the same side, you want to keep them that far apart. Subcutaneous injections, we also prefer giving them in the neck area. So, you know, looking here, it's pretty easy to see where that is, but when you go up to that cow, it can be a little bit tricky. So Dan, why don't you show us where you give injections? Don't you understand? Don't get into that.
How'd I get into this? For this, the front of this chute has what do you call it? It has some pipes that come out and gives you a good area for an IM injection. So you can do, and that also helps to keep the injections kind of spread apart. But I can give an IM injection right here without hopefully getting hurt. And then the sub-Q, I just come in right here, point at their shoulders here, and then I'll give the sub-Q right there. There's generally loose skin there, and so you can see the injections are going to be like that far apart from each other. So Bruce will be happy.
One of the things that's happened over the last 5 to 8 years is the checkoff money. You know, whenever we sell an animal, there's $1 we pay on checkoff. One of the things that's happened is it used to be that this chuck, the muscles in the chuck, the front shoulder and stuff like that were much lower value. They're still lower value, but it's not much. It's really changed, and all of this muscle tissue up here and in the shoulder, all of a sudden there's all kinds of these. What are some of the things? The chuck fillet. There's what's the flat iron steak. All of these relatively high-end materials are coming from this front end, and so if we can avoid giving intramuscular injections, period, we're going to be helpful for the industry. Every time we give an IM injection, we cause an area of toughness. There's scarring that occurs, and it's tougher than it would be otherwise. And because we've developed these new products that have much higher value than they used to, then IM injections, if we can avoid them as much as possible, we're going to help the industry and help consumers and those kinds of things. What do you think this heifer's body condition score is? And you can go up and palpate her and feel her ribs, see how much fat she has on her ribs, and take a look at that.
8, 7 or 8.
Oh, I would disagree with that. I don't think she's an 8, do you?
7.
So she's got quite a bit of fat on her.
I bet, yeah.
Yeah, looking at her, to me, just looking from a far distance, she looks like she's a 6 or maybe a 5.5 or something like that. But that's why, particularly black-hided cattle, it's real hard to look at them just in general. Oh, yeah, you can tell the really skinny ones, but it's good to go up and feel those ribs, feel the fat over the back end, and you come up with a little bit better idea. When you're working cattle and you're going through at preg check time or some other routine work time, the ones you really want to check are the ones that are thin. The 3s and 4s, want to make sure they got some teeth. It's always important if they're thin that you check their mouth, make sure they really have some teeth in there, because if they don't have any teeth, it's hard for them to gain a lot of weight. And just see if they've got any other problems. Sometimes they'll have other problems with their mouth that's keeping them from eating, and so it's a good idea to do that. Squeeze chutes, none of them are perfect because they never give you the access where you exactly want it. It doesn't matter. You may be doing routine vaccinations and preg checking today, and it's perfect, and then the next time you're going to come back and implant calves or something, and we use the same chute, and so it's kind of a challenge. And so sometimes it's a good idea to get somebody to look at your chute and build on some of these bars out front, or get movable bars or something like that make it easier on the animals. these things, although they're a pain to use in terms of time, are much better than using nose tongs. Nose tongs tend to get the animals a lot more excited. When you get them in, you not only get them in to work in the cattle, but you're also getting them in and you're training them to how they're going to behave next time. So if it's a rodeo when they come in this time, it's going to be a rodeo next time. And so anything you can do, like halters versus nose tongs, pretty quiet versus pretty rowdy, less hot shots versus more hot shots, any of those kinds of things are going to help you in terms of running the cattle through the chute and getting your work done.
I heard a good quote the other day. The only way to work cattle fast is slowly. The only way to work bulls fast is real slowly. And so those are some good words of wisdom, I think, that we should keep in mind.
Want to talk about abnormal discharges and what they might mean?
Sure. Well, sometimes they're pretty obvious and sometimes they're pretty subtle. Since we're at the back end here, we'll start here. Things that you might watch for here, not only diarrhea, but obviously things like vaginal discharges. And you can sometimes differentiate normal from abnormal too. Cattle, when they're in heat, obviously they'll have a clear mucus discharge, and so you want to differentiate that from a pussy, white, creamy type discharge, which could mean a few different things, but some kind of infection most likely going on in there. So that's what you might see at this end. And again, at the other end, Dr. Angelos was talking about eye discharges and how infectious they can be. And his trick for looking in eyes is quite simple. You can, like he said, you push on the, just push on the top eyelid, and you can make that third eyelid pop out, and you can have a good look at the third eyelid, check for foxtails, and have a good look in there for that. Again, amount of discharge can give you a big clue as to what's going on. If it's just a little bit of clear tears, that's no big deal, but a copious amount of thick stuff could indicate infection. And then, again, having them in the chute gives you a chance to really look around in there and have a look and check for ulcers. The classical sign of pink eye, of course, is an ulcer right dead center in the middle of the eye, versus something like IBR, we tend to see a little bit different pattern of lesions than with pink eye. And then, of course, nasal discharges. This cow's got some pretty normal, just snotty nose type, clear mucus coming out, no big deal. But certainly in pneumonia, you'll start seeing creamy, pussy stuff coming out. And so those are some of the discharges that you can check. And when you talk to your vet, they're going to ask you all those nosy questions. What's the temperature? What's the pulse? What's the heart rate? Any discharges? So if you have a list of those things that you might check off and have in mind before you get on the phone, it will help things go a little bit smoother once you're talking to them. Anything else, Dr. Maas?
Any questions? I mean, sometimes you can tell the animal's had diarrhea, intermittent diarrhea, by the amount of caking and stuff on its tail. Obviously, if they're having problems at the time it's flowing through. Abnormal uterine discharges, retained placentas, those kinds of things. You can take a look at those things. And get your vet to show you how to do some of this routine stuff. I mean, you don't want to go out and look at every cow that has a retained placenta. And Dr. Sutphen's going to teach his clients that, and I'll be honest with you, not all clients are equally teachable. Okay? you may not believe this, but some of you ladies that have been married more than once, you already know this, right? And so,
I've been married for more than 25 years. And
or time can do the same thing. But your veterinarian can teach you how to do a lot of things on your own, but be sure that you get that teaching and you don't just guess, because then you can get some real disasters. Some of them are irreversible. But discharges from the how many of you have been trained or do your own AI? Okay, so all of you folks know how to go in and clean up the rear end of a cow and check to see if she's got bad discharge coming out. And you don't need a lot of clinical training to figure that out. Your nose will kind of tell you. You know, cow's off feed, there's a little discharge, you know, and you go in and you check that vaginal discharge. You'll have a pretty good idea whether it's normal or not, because it'll smell real bad. You know, I hate to say that right after lunch, but that's kind of the truth. So that's, you know, those abnormal discharges are really helpful. So when you call up your vet and you say he's got 104.5 temperature, got some really bad stuff coming out of the rear end, and breathing a little bit faster than I would expect, you're going to have a pretty good idea what kind of advice to give you. It's going to save him time to come out to treat that cow initially, and it's going to save you some time and effort, and it's going to be a lot better for the cow. One of the other things, Bruce, do we have? Oh, we've got this chart up here. I'm just going to hold it up, or we can. Yeah, it's kind of tough for everybody. I'm going to hold it up, Don. This is one of those things. We get lame cows all the time, and I don't know, for those of you who have been around dairies and stuff, every time there's a lame cow, it's foot rot. Okay, that's the way it is, and that may work on dairies, although it doesn't work there very well either. But there's a whole bunch of causes of lame cows, and Dr. Hoar mentioned foot rot, and it's pretty classic. It's pretty easy to see if you can see the darn foot. If she's got mud or manure up to her fetlocks, then it's going to be pretty hard. But if you can just get a hose and clean that off, that foot rot lesion is between the toes. It's behind or underneath or in front of, and it's got a smell. If that isn't what's going on, then you need some help, because then you've got something like an arthritis, usually due to some kind of wound or a secondary infection. You've got a sole abscess. Animal's got laminitis, or you've got this disease we see in dairies all the time, what we occasionally see in beef cattle, and that's hairy foot warts. And so these cases are going to respond to our routine therapy. These other cases are not. So number one, try to take a look at what that foot looks like. Go ahead and treat for foot rot if you think that's what it is. And if it doesn't get better right away, that's the time to call or to take the animal into the clinic. Because foot rot, most all the time, responds to one treatment. And if it doesn't respond, at least get quite a bit better, cure with 2 treatments, you've got another problem, and you need to get that resolved. Any questions on foot rot? Our chutes are just not set up well for feet. You know, our beef cows, they're hard to milk, and they're hard to look at their feet. That's just kind of the way it is. And it's not all foot rot. There's some of these other lesions that do occur, these other conditions that occur. Does anybody have any questions or things you guys want to talk about?
There's a couple of things I might mention.
Yeah.
I tell my clients to check for when they call about sick calves and sick cows. And the 2 things I always ask them are what's the color, what does the mucous membrane color look like, and also whether or not they think they're dehydrated. And I kind of teach them how to test for skin turgor to determine dehydration, sunken eyes in calves, and also the color of the mucous membranes. A lot of these cattle we see with anaplasm, if they look like they're real white, we don't want them to haul them to the clinic. We want to leave them where they are. And also in parasitism, we'll see a lot of real white cattle. So I think that's 2 things that producers should know how to do, is to evaluate dehydration and evaluate the mucous membrane color and what's normal.
What percentage of our cow herd is black nowadays? I mean, all black. Pretty high, isn't it? Where do you check for mucous membranes on those calves? You open up their mouth, it's pretty dark. Sometimes you can get a peek at their eyes, and it'd be pretty white around them. A lot of times it's not. There's pigment there. So where do you check? Look right behind you, Kevin. Pull that tail open, and look in the vulva. Just spread that vulva apart, And that's a good place to check, particularly Dr. Sutton talked about anaplasm. We're seeing a lot of anaplasm. I mean, I don't know why that is, but over the last 2 or 3 years, we've been seeing a lot of it. Sorry, I should have given you those, shouldn't I? But there's a sink over there with cows. But the vulva, just open that up. Even in a black cow, it's pink inside there, or should be. If it's this color or real pale, you've got a problem. And that's a good point that Dr. Sutton brought up. Any other questions or comments?
Good thing you didn't tell you to jump in there.
Yeah, the question was, if you don't use Novosan, can you use Hexol? You can for disinfectant. It's as bad, if not worse, on tissues as alcohol. Yeah. And it feels cool on our skin that's intact. But if you got an abrasion or mucous membrane, it's pretty tough. It's real dry.
Oh, it's just drying, but it doesn't burn.
Well, if there's an abrasion, it burns. You're tough.
Where's the best place to pinch it for dehydration?
Right, particularly for calves, right alongside of the neck. Almost the same spot you're giving this injection in. When you pick that up, it should pop right back. If it's delayed a second or two, you're dehydrated to more and more degrees. The longer you can see that area you picked up, then the more dehydrated they are. So right in that area, that's a nice spot to do it for dehydration. Also on the calves, as Dr. Sutton mentioned, their eyes start to sink back into their head, so it's pretty easy to tell from that standpoint too. It's sometimes hard to know if they're 5% dehydrated or 10% dehydrated, but whether they're 5 or 10, they're going south on you. So you're gonna have to do something. A little bit of dehydration in a calf just means they're going to be more dehydrated in a few hours. You just caught them earlier, which is helpful.
Maybe I'll just mention a couple of tags that this heifer has that you might not be too familiar with. In the left-hand side, there's an EID tag, electronic identification. Dan has a scanner. He can scan that tag, and next week, hopefully, on this computer, it'll pull up that cow's record, and we'll be able to enter data real time as we're going through. It can be hooked to the weigh scale, so it'll automatically enter the cow's weight into the database as well. And on the right hand, on the right ear, is a tag that says iGenity on it. iGenity is a part of Mariel. It's a part of Mariel company, and that is genetic identification. So they have all the sire and dam information on all these animals now, so they can do DNA parentage testing on all of them. iGenity has a number of other tests available as well, but primarily the parentage testing is what we're using here.
Are we at our 30 minutes?
You're close.
Any other questions or comments anybody has?
How about cleaning a syringe needle? If you're using a live virus, can you clean it with Novosan? Or will it affect the vaccine?
That's a good point. Why don't you just tell us about that?
I asked you, John.
As we use disposable needles, but we use them 10 or 12 times before we dispose of them. And so sanitation becomes very important because there's no place on a cow's hide that's sterile. So you're gonna pass things around a little bit. So what we commonly recommend is that you disinfect those needles between each use, except when you use a modified live virus vaccine. And in that case, we could actually, disinfect the live virus material, so it's just like putting in saline. So for those, you try to keep them clean without using a disinfectant like alcohol or Novosan or Hexol or chlorine or whatever you're going to use, iodine, whatever. So don't use it in those cases, but everything else you can use. And then make sure you don't mix up those syringes. Make sure you keep your modified live virus vaccine syringes for that, and the other ones for the other purposes, because you will inactivate those vaccines. We go to all the work of gathering the cattle, bringing them through the chute, buying the products, And if we don't handle that stuff appropriately, that's all just an exercise because we don't immunize the animal if we disinfect those vaccines. Those are important things to consider.
Just hot water, is that good enough? Or will that be?
What we usually do is we just keep them clean, and then every 5 to 10, put a new needle on. Put the old one in the sharps container, and don't worry about it. Does anybody disinfect with hot water? Or, I don't. We just keep them clean, and don't worry about them. For the vaccines that are killed products like the Clostridial vaccines and the Vibrio lepto, then you use the disinfectant after each go round. And I like Novosan once again because it's not tough on the tissues. It's easy on the tissues.
Dr. Maas, can I interject for a second?
Yeah.
One thing that I do with to keep from filling up, going back to the cooler and filling up the syringe with the wrong stuff is I take the colored electrical tape and I'll put it like a green around the syringe that I'm using for Clostridial, and then I'll take that same green tape, put it around the bottle of Clostridial, and black around the respiratory. And now these Allflex sells the little buttons at the little ball at the end of those automatic syringes. You can buy those in different colors, and basically the same idea, but I don't know how many times it probably happens fairly commonly because some of the Clostridial vaccines look just like respiratory when they're like with your model of live after they're mixed, and they both basically look the same. And if you use that bottle to get out of the syringe and you go back and look and think, what in the world was I doing this? It's just a little thing that I started doing, and it works really well.